Hello and welcome to Delta Cast Tutorials. My name is Lindsey, and I'll be applying a Thumb Spica Cast using the functional cast therapy technique. This cast will be used for injuries to the thumb, first metacarpal, areas of the wrist and collateral ligaments, tendons, and anything where you need to prevent certain movements such as constraint-type splints. The goal is to allow for full range of motion of the fingers. Make sure the cast terminates proximal the length it needs to go. And then we're going to position the patient, such as 20 to 30 degrees of wrist extension and the thumb and index in direct opposition. Let's apply the Delta Terinet Thumb Spica stockinette. Roll up the stockinette for easier, gentle application and cover the thumb first, then unroll going proximal. Then add the zip stick by placing it underneath on the dorsal aspect. Slide in as delicate as possible. Apply the Terinet adhesive foam padding to areas where we need to provide more comfort, such as the bony prominences. So the radial styloid, the ulnar styloid in particular, I'll later add some padding on the lateral sides of the IP portion of the thumb and the dorsal side of the first metacarpal on this occasional. The padding around the thumb is particularly important to ensure the cast is snug but not tight and uncomfortable. This padding in key specific areas allows the splint to be donned and doffed with more ease, but securely stabilized. You don't have to make perfect shapes, but just enough to cover the area of sensitivity. Apply gloves, and we will be using Delta Cast conformable tape. It's a fabulous casting tape with a three-way stretch, adding more conformability. All right, the first thing you want to do is make your fan folded layers with at least 2 layers for strength for the area of need. Then, using the rest to wrap around to have at least 4 layers when finished. If you need more time, apply the fan folded layers dry or don't activate them with water, so that gives you more time to form and mold to the extremity a little bit better. You can roll down the stockinette on top of the thumb for more aesthetic purposes. Activate the remaining cast tape roll by dipping it in room temperature water for at least 3 seconds. start at the wrist or the thumb, but cover the thumb up immediately as possible. Make half cuts on the width of the tape to go around the thumb more easily. And as you can see here now, I have at least 4 layers around that thumb for strength purposes. Ensure there are no gaps in the critical areas of the cast. After you completed the thumb and the hand coverage, ensure the thumb has no light areas. And then finish going more proximal using the 50-50 coverage method. Smooth out the fan folds as you further cover the extremity. Ensure there are no major gaps for strength purposes. Once the cast tape is fully applied, start laminating by rubbing the cast to press all the layers together. Ensure the position is what you intend it to be. Make note of any ulnar and radial deviation. Continue rubbing the cast until it starts to cure and hold its shape. This should take at least 3 to 5 minutes for it to hold its shape. The goal after the splint is set is to make markings for more conservative cuts, removing only unneeded material. First, you want an angled or oblique angle in the distal palmar crease area for increased range of motion, and then we'll trim along the web space for good opposition of the index finger to that thumb. And we'll take out 1/4 of an inch of the width where the zip stick is to ensure the cast does not pinch the skin. Here's the pearl that can help you. If the cast is set, but still a little tacky or sticky, you can use that as your advantage and apply the Delta Terry net hook early, so it adheres to the cast surface stronger. Make as many hook straps as needed. 3 to 4 are common for most forearm-based casts. Curve the edges to prevent the hook from rolling up off the cast. Try not to put your fingers on the adhesive backing, as the oils from your fingers will make the adhesive less sticky. Apply the straps and smooth down. Another note or pearl is to use a heating gun to warm up the adhesive on the back of the hook and then place on the cast surface. Now cut along the zip stick with your FCT scissors. Squeeze and bow up the cast underneath to add more space with your other hand. And remove the zip stick gently. And then remove the cast off the extremity slowly. Lastly, now it's time to trim all the unneeded material where you did your markings. Curve the corner edges where the cast will meet and then trim out 1/4 inch out of the middle where the zip stick was placed so that the cast does not pinch the patient's forearm when closed. Fit the cast on the patient again to ensure that everything is trimmed adequately for the needed range of motion. Now let's add the Delta Net Fleece Edger. Start on the straightaway to make it a little bit easier. Placing half of the fleece edger on the outside and then half on the inside and then lay it down. Next, go around the curved areas slowly to prevent wrinkles. Also, you can pedal the fleece edger by cutting slits with scissors in some areas to make it lay down smooth. Once applied, I like to lay down the most curved areas first around the top portion of the cast, then the rest. Now I'm back to the straightaway again, placing half of the fleece edger on the outside and then half on the inside and then lay it down. Lastly, go around the bottom portion of the cast as shown to finish this stage. This last stage we're going to finalize and apply the cast on the patient to ensure it fits properly. Lastly, we're going to add the Delta TerryNet loop. This secures the cast on the patient's extremity. Then cut off excess loop. Next, I'd like to add little tabs on the ends of the loop to help the patient visually to better distinguish which portion to pull to when taking the splint off. This is the Thumb Spica Cast using the functional cast therapy technique. Thank you.